Hello, this is Dr. Susmita Ghosh and I'm the consultant at the Swallow Clinic of AIM Medical Center. At the Swallow Clinic, we attend patients, mainly stroke patients, patients with Parkinsonism, head and neck cancer patients who had undergone surgery or radiotherapy, aged patients who have difficulty in swallowing. So, how do you identify these patients who have a swallowing problem? These patients, they'll take a lot of time to eat their food, or there will be spilling of food from the mouth. They won't be able to take the food inside, or there may be a cough during swallowing. When these problems occur, these patients are referred to the Swallow Clinic so that they can eat their food properly and lead a good quality life. So, what do we do with these patients at the Swallow Clinic? First, we consult the patient, we examine the patient clinically, we take their history and see where the problem lies. After that, we do some endoscopic assessments with different types of food, like thin liquids, that is clear water, with the puree food, that is maybe yogurt, and solid food, bland biscuits, and so on. So we put in the endoscope and we ask the patients to eat these food of different consistencies, and we do a recording to see where the problem of the patient lies, which muscles are weak, so that the patient is having a difficulty in swallowing. And to us, another important thing is that whether the patient is aspirating or not, that is whether the food is entering the lung, which may be life-threatening because it can lead to pneumonia and it can lead to losing the patient. So after we do this assessment, which is mostly a teamwork, we are there's a ENT surgeon, there's a swallow therapist, there's a nursing staff, and as a whole we assess the patient and then we create a protocol on how to treat the patient. Each patient is a different individual who will respond to a different mode of treatment. So this assessment is very much necessary to create the protocol of treatment also, apart from seeing where the problem lies. Then we modify the consistency of the diet of the patient. We teach the patient different techniques of swallowing. We give them different exercises to strengthen up their muscles. And in some who do not respond to all these modes of treatment, there are short surgical procedures which can be done on office basis. That the patient comes in, a short procedure is done. We have a very good operative theatre in this AIM Medical Center with a good backup, with a good anesthetist. And so we do some short surgical procedures and the patient may go home. So this is in a nutshell of how we treat the patient so that they can lead a good quality life, sitting with their friends, sitting with their family, and they are off their nasogastric tubes, they are off their PEG tubes, and they can eat properly and lead a life very happily. Thank you.